lots of open fires and burning of plastic is that the air quality becomes very bad. And we measured very tiny particulates in the air that can get very deep into the lungs, and we found that they greatly exceeded the World Health Organization standards. Next slide. So we found in the camp that people were receiving one meal a day, and so the temptation when you receive one meal a day is to hold on to some of that food because you're going to be hungrier later in the day. Unfortunately in the camp there's no way to safely store that food. So these are pictures of the meal packages that people were given just on an open shelf in a kitchen area of one of the sub-camps. Because the food can't be kept properly cold, and because it's being mixed up with donated food that also can't be properly cold, maybe can't be cooked as hot as it should be, we'd start to see bacteria present that are associated with poor temperature control. So by taking these samples, we can say, okay, we have evidence here of bacteria that can make you sick at levels that can make you sick. And this is hard evidence that, you know, the living conditions there are impacting on people's health. We also looked at the water. So in the Calais camp, there were 5 water points that looked like this. They only had cold water. People didn't have access to hot water. Are you familiar? Yeah. No hand washing facilities associated with the toilets. So you can see. Actually, we can't see on this. One of the water points was leaking, one of the hoses was leaking, and we always consider that if water can escape, contamination can get in. So that's a very bad sign from a public health point of view. We took some swabs of the surfaces of the taps, and we found there was evidence of fecal contamination. And we think that was something to do with people using the bottles to clean themselves for toilet purposes, and also the same taps were being used for drinking water. So we found levels of fecal contamination in the water supplies in the camp. So a little bit more about the water. A lot of people were using these containers, which I think they found on the site, because the site was a bit of a dumping ground before it became a camp. Now these containers, they can't be covered properly, they can't be kept clean, and perhaps the thing of most concern is that a lot of them had labels on which said corrosive. And obviously we don't want people drinking from containers that have held corrosive chemicals in beforehand. So, like anybody, if you're living in very difficult circumstances, you do what you can to try and make the best of things. And this was a shower that people had built in the camp. It wasn't really a shower, it was just a private place to get undressed and have a wash with a bucket of water. But people are resourceful and they try and find a way to take care of themselves in the most difficult circumstances that there are, because the showers that were provided really weren't sufficient for the number of people living in that camp. Yeah. Okay. I've saved you from the worst of my toilet, charming toilet photos. You've got the edited version here. So there were different sorts of toilets available. There weren't enough of them, and they weren't being cleaned regularly enough. And if that's the case, what people will do is go to the toilet in the open air, because they don't want to use conditions that are dirty, and they're concerned about infections and getting unwell. These particular toilets were very unpopular because they're called long drop toilets. People who've been to festivals will have seen these, not pleasant. Weren't being emptied as frequently as you would expect, so people were very unwilling to use these toilets. No hand washing facilities associated with the toilet, so obviously in public health we're very concerned about what we call the fecal-oral route. So people maybe are not very well, they go to the toilet, hands become contaminated, then they go on and prepare food, and then that contamination gets passed on, and we start seeing outbreaks of diarrhea and vomiting. And a lot of the people I spoke to had had those sorts of problems, and also had respiratory infections and coughs and sore throats, which we think were associated with the air quality as much as anything. We also did a survey looking at any evidence of pests and trying to document the sort of shelters that people were living in. So you would have seen the first photo that I had up on here. They were kind of showing tents that had been donated, but also structures that people had built with donated planks and pieces of tarpaulin, yeah? And we found, you know, when you go camping and you wake up in the morning and everything's a bit damp from condensation, everything's a bit soggy, yeah? This was happening in Calais, obviously night after night after night, so people weren't having a chance to dry out their bedding, and this was in the summer, so yeah, in the winter it would have been much worse. We had a lot of reports of mice, rats, some reports of bed bugs, lice, a lot of reports of scabies. Now you treat scabies by putting cream on and then being able to wash it off, and also washing bedding very, very hot. And obviously in these conditions it's not possible to do that. A lot of the structures were leaking, they weren't very stable, they certainly weren't warm. Okay, it's just a final picture. I hope that I've shown you the role of academics and universities in trying to document the situations that we see. And I'm sure, certainly my door is very open to anybody who wants to do some research in these areas, and I'm sure you'll find that your local universities would be very willing to work with you on this. And it does help to provide some evidence that is quite difficult to argue with. Thank you.